Hi, OCGF family. This is Avian from Bethesda Health Ministry. Today, I'm going to be talking to you about COVID 19. The information I'll be sharing comes directly from the CDC and should be used only for informational purposes. What is COVID 19? COVID 19 is a respiratory disease that spreads from person to person caused by a new coronavirus that has not previously been seen in humans. On February 11, 2020, the World Health Organization announced an official name for the disease that is causing the 2019 novel coronavirus outbreak, which was first identified in Wuhan, China. Most people have mild illness and are able to recover at home without medical care. So, this is not a death sentence. So, how is COVID 19 spread? It is spread by person to person, where you can handshake um, from a surface or an object to a person, like touching a light switch, touching a countertop that was contaminated, or by community. How is it spread person to person? When you come within 6 feet, close contact with one another. So we're asking for social distancing. Respiratory droplets, they say that's how it's spread. And this is produced when an infected person coughs or sneezes into the air without covering their face. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. People are thought to be the most contagious when they are the sickest. However, some spread might be possible before people start to show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way that this virus spreads. Want to avoid touching your eyes, touching your nose, touching your mouth without first washing your hands because you may have touched a contaminated object or surface. So just be mindful. And I know it's difficult to do, but try not to touch your face. Here we have an example of how what is droplet precautions? And as I had said earlier, droplet spread happens when droplets are coughed or sneezed from a sick person, and it can splash, where it's splashed into your eyes, nose, or mouth of another person, or cause environmental contamination, like soiling a bathroom surface or a handrail, a doorknob, um, your cell phone, wherever from which another person can pick up the infectious material. How is it spread from surface or object to a person? It may be possible that a person can get COVID 19 by touching a contaminated surface or object that has the virus on it, and then touching their own mouth, nose, or even their eyes. But this is not thought to be the main way the virus spreads. And we talked about the surfaces: mobile phones, remote control, counters, tabletops, doorknobs, light fixtures, toilet seats, keyboards, tablets, faucets, turning on water, bedside tables, or areas that may have come into contact with blood, stool, or any bodily fluids. Here are some of the surfaces that should be cleaned and disinfected frequently because people are touching it and can touch it after sneezing or coughing into their hands. So, handrails, doorknobs, cellular phones, keyboards, shopping carts are a big one, toilet seats, remote controls, turning on the faucet, turning off the faucet after you've washed your hands, the elevator doors, keys, and the countertops. Community spread. Community spread means people have been infected with the virus in a common area. including some who are not sure how or where they became infected. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community in some affected areas. So, what are the symptoms? Usually, these symptoms may appear 2 to 14 days after you've been exposed. And the symptoms can be mild, can range from mild, such as fever, cough, shortness of breath. And it can, with these mild symptoms, they're saying stay at home, quarantine yourself for 7 to 14 days. Just you can, if you're healthy, get over this. If you notice that the symptoms are getting worse, such as trouble breathing, persistent pain or pressure in the chest area, becoming confused, or being unable to be awakened, if you notice your lips or a bluish tinge to your lips or your face, this is when you should call your doctor, your local health department, and they'll give you instructions on what to do. You cannot just go straight to the emergency room. They can send you somewhere for testing. They'll make an appointment for you. They'll ask you questions, and you take it from there. Okay, how do we prevent this? Good hand washing. Keep your hands clean. Frequent hand washing with soap and water. I have a YouTube video here. You click that link. It'll show you ways to wash your hands for 20 seconds. When you cough or sneeze, cover your mouth and nose. Avoid crowds. Get sufficient rest. Take your vitamins. Clean and disinfect all frequently touched surfaces, shopping carts. Stay home if you're sick unless you need medical attention, and we talked about how you should go about that. If you have to go out while you're sick, you need to wear a mask. Do not share household items, and eat at home or get food delivered, have someone pick it up, or go to the drive-through. Big one is when you're sneezing, cover your mouth and nose with a tissue. When you cough or sneeze, wash your hands after using that tissue. Or use your elbow if you're wearing long sleeves, or your shoulders if you're wearing short sleeve when you're sneezing. Here's an example if you go out, the distance to keep. This is called social distancing, which is 6 feet apart. This just shows you when someone coughs or sneezes where the particles, how the particles can spread and the distance that it spreads. Clean and disinfect all your frequently touched surfaces, your countertops, um, doorknobs, light switches, cell phones, remotes. CDC has information on cleaning, on the solution, the bleach solution, how to mix bleach and the proper equation. Also, they also say to follow the manufacturer's instructions. There must be some ventilation. Don't do it in a closed room and stuff like that. So here you stay at home. A lot of companies are allowing people to work at home. If you go out, wear a mask, especially if you're sick. Um, Eat at home or get takeout. Here are some household items that you should not be sharing. Eating utensils, cups and glasses, towels. If you're using it, get a clean towel, pillows, etc. So who is more at risk for this disease, for this virus? Older adults are at risk. People who have had serious underlying medical conditions such as heart disease, diabetes, lung disease, kidney disease, weakened immune system, and so forth. If you or someone in your family have this, then you should be taking extra precautions to prevent this from affecting you by doing the preventative tips that I talked about earlier. What can you do? First of all, we should pray. We should read the Bible. We should ask God for wisdom and direction. This is an opportunity for us to spend time with our family at home, uh, have Bible study, um, worship. Take advantage of this time. Do not go to the emergency room unless it's an emergency. There are people there that are sick and need um, care, and you don't know what's there. You want to prevent yourself from getting sick. Call your county health department or your medical doctor if you feel you have these symptoms, and they will direct you. Wash your hands, practice social distancing, sneeze and cough into your sleeves or shoulders. Please do not hoard food and toilet paper. Yes, get sufficient, but remember we have to be mindful of others. Give other people an opportunity to get um, some food and some toilet paper so everyone is taken care of. And think about others also by not sharing bogus information, false information about COVID 19. There's a lot of information out there, a lot of information. Not everything on the internet is accurate. Look at reputable sites such as the CDC. Um, Use that as tools. If you think that you might have gotten something that is not accurate, don't share it because there are a lot of people out there that are fearful, and we're not practicing fear, we're practicing faith. I've added some scriptures at the end just to encourage you. Our trust is in God. Um, God, the word does talk about deadly pestilence, and but we are protected. So be encouraged, and thank you.